Hello, listeners. You are listening to Radio Amity 107.8 FM. I'm your host, Suhani Singh, President of Amity University Reiki Foundation Center for Science of Happiness. With my co-host,
myself Sanchita, student at Amity Institute of Psychology and Allied Sciences.
We welcome you all to a very special and insightful episode of Shaping Brighter Future. Whether you are a student curious about the workings of the mind or just someone eager to understand mental health better, you are in for a treat today.
They say the mind is not a vessel to be filled, but a fire to be kindled. And who better to help us ignite that fire than our incredible guest today? We welcome you, sir. We are honored to have with us a distinguished psychiatrist, a true beacon in the world of mental health. Their work has transformed lives and guided many through the maze of emotions and thoughts we all experience.
So students, brace yourself for a conversation that's bound to challenge, inspire, and energize your curiosity about the human mind. Let's welcome Dr. Madhur, who has 6 years of experience in the field of psychiatry. He believes that a healthy mind starts with a healthy life. He is a renowned keynote speaker. He has a keen explorer of mysteries of mind in both illness and wellness. He has treated and helped many patients through his psychiatric experience over the last 6 years with therapy and medicines. Educationally, he has completed his MD in psychiatry from Osmania Medical College and Institute of Mental Health, Hyderabad. His MBBS from Indira Gandhi Government Medical College, Nagpur, and postgrad diploma in clinical hypnosis from Charusak University, Vadodara. He has previous experiences in Institute of Mental Health, Hyderabad, Postgraduate Institute and Yashwantrao Chavan Hospital, Pune, and Pavna Multi-Speciality Hospital, Pune. He has a professional membership in Indian Psychiatric Society and Hyderabad Psychiatric Society.
As Rumi once said, the wound is the place where the light enters you. Let's dive deep and let the light in. Without a further ado, let's get started. So sir, starting with a very simple and basic question. What inspired you to pursue psychiatry as a profession?
Thank you, Suhani and Sanchita, for having me over today. I think that's a question which I used to ask myself a lot of times. And so I tell that when I was doing my MBBS, during our clinical postings, I used to go to surgery ward, to gynae ward, to medicine ward. And I used to see that there are patients who are very critical, but they still have a smile on their face. And there are patients who are recovered, but they are still not happy. And that's when I realized that probably there is something beyond body that is so close to a human being, to a human mind. And that is when I realized that I want to know a person beyond their body. I want to know a person as how they see themselves. And the only branch of medicine which would have helped me go there was psychiatry, because it was the only branch which was related to psychology. So that is where I developed interest towards psychiatry, and it's been a wonderful journey there onwards.
Right, sir. Sir, just like all of us, just like you, I was also curious to study human mind, but my inclination was towards psychology. What inclined you towards psychiatry, like towards biology?
So, my dad is a doctor, and I can say I did not have any other option than being a doctor. And when I was young, I used to think that one day I would do PhD in psychology. But when I ended up doing my MBBS, I thought that I have a shortcut to enter into the field of psychology through psychiatry. So that is how I just came in.
That's great, sir.
So next question is very related, but what is the most rewarding aspect of being a psychiatrist?
I think the most rewarding aspect is to understand human beings, listen to different stories day in and day out. People generally think that we as psychiatrists deal with a lot of sad stories or deal with a lot of sad emotions or negative emotions of people. But I would say when I sit in my OPD, day in and day out, I see stories of hope. I see stories of support. I see stories of families which are coming together to help somebody. I see stories of people who are fighting through all odds, redefining themselves and identifying their own strengths. So it is not all sad or it is not all gloomy. There are so many smiles. There are so many, light moments also happening in that OPD chamber. And when people can come and tell you their deepest things that they would resist to tell even their family members, I think being able to provide that space itself is a very rewarding experience.
So how do you feel when people come and they share their darkest and deepest secrets with you?
I feel that they trust me. I feel that because see, it's a human nature that you would have different kind of emotions, you would have different kind of thoughts. I was once attending a conference in Lucknow where there was another keynote speaker, Dr. Salman Akhtar. He's a very renowned psychiatrist and psychotherapist. And I asked him the same question. So I was in my first year of PG then. I told him that, sir, people come and ask us, ki, you listen to so many sad stories, how do you deal with it? So he gave a very good example. He said, when the Samudra Manthan happened, the poison that came out, Shiva had to drink it. But he did not let it affect him. He kept it in his throat. The job of a psychiatrist or a psychologist is like that. We all have good and bad sides to say, but we cannot let that affect us. We have to listen to that. We have to keep it in our throat, not let it impact our own selves, but let it dissipate or let it out by ourselves having a healthy life and a healthy family support. So I think somebody has to do the work with the dirty side, but it is a pleasure to be able to do that, because if you're able to provide that space to somebody, that person can go back to their own self and put those things out.
Right, sir. Sir, that's a really, really great insight. Thank you so much. So, sir, coming to the very basic and a myth buster question, what according to you is the difference between a psychiatrist and a psychologist?
So, a psychiatrist, as I said, goes through MBBS, then MD, DNB or diploma in psychiatry. So we are allowed to write medicines because we have studied pharmacology, and some of us are also taught therapies while we are going through our curriculum. But on the other hand, psychologists are predominantly dealing with assessments, dealing with therapy, dealing with counseling. They are not allowed to write medicines. So that is the basic difference.
Thank you, sir. So coming beyond these general questions, I would like to ask you, from a psychiatric perspective, how would you define happiness? Is it the same as mental well-being?
I think mental well-being is like a car which is in perfect condition, where all the parts are functioning well, and happiness is just one part of it. So we cannot say happiness is mental well-being, because in fact, if somebody is very happy, we call it hypomania or mania. So being very happy is also an illness. So optimization is important. So happiness is important. But when it comes to mental well-being, I think being able to feel all your emotions optimally, operate optimally out of them, understand them better, is what is mental well-being. While happiness is just one emotion, which is important, obviously, but it's not the only emotion that you should be feeling all your day.
So, sir, my next question it is related to bio. So, what role do brain chemicals like serotonin and dopamine play in the experience of happiness?
Both. If I talk about dopamine and serotonin, both of these chemicals, and there are some more also. There is GABA, there's glutamate, there's norepinephrine. All of them have their own roles to play because they act in different areas of brain. Serotonin, we generally say, is related to happiness. Dopamine is related to motivation. But when you are motivated and you feel that reward, it automatically leads to happiness. So there are complex circuitries running in the brain, because the brain is like the projector and the mind is like the image that comes out of it. Right? So if something is wrong in the image, we have to go and fix the projector, not the screen. So that is how these chemicals play a role. And that is what we work on as psychiatrists with medicines.
Right, sir. So just a very general question. In today's generation, we see that there's a lot of dopamine chasing or dopamine rush that we all youth somewhere chase or somewhere run after. So how can we curb that? We are so used to dopamine spikes these days that we are only getting into instant gratification, things that give us instant happiness. How can we curb that?
I think one thing that I would like to correct is it's not happening only in today's generation. It has always been there, right? Because if something makes you feel good, you want to do more of it. And that has been there since time immemorial. Like that's how humans progress. But today, because of the social media and because of the Swiggy, Zomato and tools at hand, instant gratification, you're getting gratification instantly. You have the possibility to make it happen. Earlier, that much possibility was not there. So a way to curb that is obviously you have to keep a check, because, there are normal human activities also which would lead to release of dopamine. But obviously that would lead to a certain extent, that would release to a certain extent. People have this habit of putting sometimes external substances in body which gives them a dopamine kick. But what happens is the brain gets exhausted doing it again and again because it's against the nature. So we have to keep a watch on what makes us feel good. And I think, as I said, optimization is the key. If we are able to keep a balance between doing some natural things which would help us release that degree of dopamine, then that is something that is definitely going to help us in the long run.
Right, sir. So one more question. Is it like that dopamine or other these like chemicals, they work at some optimal level, like they'll reach some optimal level, and after that, whenever you achieve or whenever a human mind achieves this optimal level, they crave for more and more, and whenever they are not able to achieve the optimal level, they might not get that particular emotion, let's say happy or sad or something like that?
See, as I said, optimality is definitely important. Like in my body right now, there are 6-7 hormones. All of them are running in a particular balance. Okay, if my thyroid is say 5 units, then some pituitary hormone, other hormones are 10 units, and they are trying to keep a balance constantly, right? So in the same way, these neurochemicals in the brain, we need to keep them in the balance. Any one hormone going up or any one neurochemical going up is going to mess up with the whole system. Like you're seeing a projector, if I suddenly just increase the red screen, so red color, then it will change the complete balance of red, blue and green, and the screen would look completely red. In the same way, we need to keep a balance of all these different chemicals, and body normally keeps it. So when we are trying activities or when we are trying substances or when we are trying from external sources trying to increase these, then we are basically leading to imbalance. When we lead to imbalance, body also tries to maintain that balance, and it would have to increase or decrease other chemicals to keep that balance. But because the bodily systems take time to take over, and the external substances would do it instantly. It comes rapidly, it goes rapidly, and then the body is left confused of what exactly is happening.
Great, sir. Thank you so much for that insight.
Okay, so as we are talking about the today's generation, we know how technology is on hype. So what are your thoughts on rise of telepsychiatry and digital mental health tools?
I think it's good because I remember 6-7 years back when I had started, we were telling there's so much stigma, and compared to say what would have been 20 years back, stigma was less, but we still know that we are not able to reach to as many people as it is needed. So now with digital tools coming up, with COVID coming up, people experienced a mental health crisis, and then also they came up with solutions to that, which is the online tool, which has suddenly boomed post-COVID. So I think it's a good thing because one, it allows people to maintain their confidentiality. Second, it allows people to have access to the means. Third, the only thing which I am a bit worried about is that people are not checking credentials of who they are listening to or where they are getting that information from. So I think that is an important part. If you're taking information and trying to implement it in your life, make sure that you take it from the right sources. Otherwise, it can lead to more harm than good.
Agreed. So don't you think this path is leading to a self-diagnosis?
It is, but I think apart from self-diagnosis, I agree, it is leading to self-diagnosis, but it is first leading to self-awareness and then leading to self-diagnosis. And what I generally say is when you're aware that something wrong is happening, you reach out to the right professional. If my computer is not working well, I am not from the computer background, I would try to fix it, I might end up screwing it more, right? So I don't want to mess up that. In the same way, you don't want to mess up your internal computer, your brain, your mind. So if you sense that something is wrong, it's always good that you reach out to a psychologist or a psychiatrist, any trained mental health professional who would help you understand it better. Because sometimes when people self-diagnose, they stay at diagnosis. The purpose of diagnosing is to be able to treat it, is to be able to cure it, is to be able to remove it, right? But if you are stuck in that loop of diagnosing yourself and not taking any action, then that is going to be more problematic.
Understood.
Agreed, sir. Sir, but don't you think in these days there's overstimulation of mental health awareness and more of self-diagnosis as she mentioned? And how is that harming the youth?
As I said, youth are diagnosing themselves, but at times wearing it as a badge, not treating it, or using it in a way to stand out. But I think very common use of mental health terms is leading to the harm to people who are actually suffering, right? Because just if you're wearing it as a badge, it is not what you do with a term like depression or with a term like OCD or with a term like ADHD. These are medical disorders which needs to be treated. So if you're just saying that I'm depressed and not doing anything about it, then you're not doing any good for your own self or anybody around you.
Right, sir. I completely agree. Sir, the next question is, what are some of the most challenging cases you have encountered, and can you share some?
So that I think in last 6 years, there must have been more than 6,000 cases that I have seen. But to say a few, I remember a recent one. One of the biggest challenges that we generally face is when a patient comes, their query is, Dr. Saab, would I become addicted to these medicines? Would I have to take these medicines for lifetime? Sometimes they have significantly severe problems, but they resist those medicines. So I recently saw a case of postpartum depression who was having the same queries that if I take this medicine, would I have to take it lifetime? What would happen? Would it harm my baby? And I had to make her understand that no, that is not how it works. We would take you off medicines. Let us start the medicines. Let us see how it improves. When she came in for the first time in my clinic, she was crying inconsolably. Just a medicine of around 20 days. She came smiling saying that I'm feeling better and I think I can feel much better now. Because what I'm feeling right now, only with 20 days of these medicines, I haven't been able to feel like this for last 6 months. So medicines do have a very good role to play when they're given properly. So that is what patients go through. That is what they feel. And breaking that stigma is one of the biggest challenges that I think we face. Because the older medicines that we had were not that, they had side effects like drowsiness, they had side effects like it used to be taken for a longer time. But that's not the case now. And I think that is what I want to tell.
Thank you, sir. Sir, so can you advise our listeners how they can build sustainable happiness rather than relying on quick fixes or momentary pleasures?
I think a good support system, good diet, good sleep, and a healthy routine inclusive of exercise or sports is definitely going to impact a lot, right? Because these are some of the things which would normally help you release the endorphins, the dopamine, the serotonin. And in the long term, doing these things persistently is what would help you to be happier and more productive in day.
Sure, sir. So coming to the end of this podcast, we have a small rapid fire round with you.
Oh.
And in this rapid fire, you have to answer in one word or a sentence. So starting with the first question, what's your go-to stress relief activity?
Poetry, listening or writing.
Great. Next question, therapy or medication if you had to pick one?
Therapy, when the things are not severe so that they don't become severe and require medicine.
So one sentence.
It's a
Okay.
difficult question you're asking me.
Next question, what's your guilty pleasure TV show or movie?
I think The Family Guy.
Great. I also like that. Most underrated mental health tip.
There's so many. Good sleep.
Okay.
Okay. One of your favorite books on mental health?
I recently read Maybe You Should Talk to Someone by Lori Gottlieb.
Okay. If not psychiatrist, then what?
Poet.
Do you have any favorite fictional psychologist or psychiatrist character from TV or movie?
Not psychiatrist, but I, in a way, like Dr. House.
Okay. What's your favorite brain fact?
Neuroplasticity. The ability of the brain to change itself, to change its ways, to get better. I think it's astounding what a brain can do.
A huge thank you to our guest for sharing such valuable insight on mental health and psychiatry. I hope this conversation has given you a better understanding of importance of mental well-being and how seeking help can make all the difference. I request you, sir, to please share some last note.
Okay, so to conclude it, I would just say a share of mine कि दुनिया के लिए मिसाल रखो, अच्छे लोग संभाल रखो, दुनिया को जरूरत है अच्छाई की, सुनो तुम अपना ख्याल रखो.
Wow.
Wow.
That's
Thank you
so
so
heartwarming.
much, sir.
Thank you so much, sir.
Stay well, stay mindful.